Okay, go ahead and introduce yourself.
Nisha Krishnaya.
And how is this program versus what you expected?
I think it's a nice mix and combination of the theoretical, the didactic, and the clinical experience.
And how does this program compare to other similar programs?
At least for me, the ones I had researched in the last few years, there wasn't anything similar in the Bay Area. And I come up from the city, from San Francisco. So I was glad to have anything in the Bay Area. And I know, as far as I know, there wasn't anything in the city either available that was this in depth and intensive as it is in terms of just, revolving around an entire implant course in which I didn't have to travel.
And what do you think of the 1 year commitment?
I actually think it's a really nice amount of time. I think it takes a few months just to kind of, understand and understand the clinical procedures and the products and how to use them. So I think actually a 1 year commitment is, I think, perfect.
And would you recommend this program to somebody else?
Yes, absolutely. I've already recommended it to my other colleague friends, and I think they're interested in definitely learning more about it.
So you just finished a clinical day today. So give me a brief rundown of your day.
Today in the morning, we placed an implant in the area of number 12, and we did a bone graft, a couple of teeth behind that. And then in the afternoon, we did some extractions and bone grafts and suturings, and of course, scans after each procedure. So it was again, nice mix of actually getting to place an implant and extractions and bone grafts, everything, all the necessary components involved in implant procedures.
Awesome. Thank you so much.
Yeah, thank you.
How about me?
Oops, hold on. Okay, go ahead and introduce yourself.
Hi, I'm Dr. Maria. Okay. Hi, I'm Dr. Maria Isabel Tuhi, and I'm in level 1 of the program for the AII.
So how is the program versus what you expected?
I think it's better than what I expected. Definitely experiencing, just in general, how to do the actual surgery, but even more than that, learning from my mistakes and just changing how to do certain things, procedures and such.
How does this program compare to similar programs?
I've only taken one other program, but it was a shorter program about 10 years ago, and so this one definitely gives me the confidence as well as the experience. So I love this program.
What do you think of the 1 year commitment?
The 1 year commitment is great since you don't really learn anything the first try, so you kind of have to do things quite a few times until it's solidified. So, and Dr. Hannah is great at kind of and the rest of the staff, of course, are great at telling us that, or just reminding us things that we may forget from time to time.
Would you recommend this program to someone else?
Absolutely. So, if you haven't signed up, better sign up.
So you just finished a clinical day. Can you give me a brief rundown of your day?
Today we did a couple of surgeries, and so today in the morning we placed an implant as well as some bone graft on a patient. Sometimes, you also have to deal with some, the case wasn't as difficult, more so dealing with patients sometimes were difficult. So that's another different story, different experience in and of itself. But, you learn from that as well, right? And then in the afternoon, we did some extractions and bone graft, and lots to learn from as well, since there were certain things that we didn't do before in previous bone grafts that we did today. So, yeah.
Awesome, thank you.
Okay, thank you.
Okay, could you please introduce yourself?
Hi, I'm Dr. Eunice Gonsalves.
And how is this program versus what you expected?
Oh, it's so much more than what I expected. So I was just expecting like an implant placement program, but then there's so much more to learn, and Dr. Hannah is just amazing, and Dr. Botros and Dr. Jeff. I have learned so much, and every day I'm learning something new, so exceeding my expectations.
How does this program compare to similar programs?
So I have friends who've done implant placement programs, and they've just been to these programs where they go in for like 7 days or 15 days, and they just do a crash course on implant placement, and then they come back and they're doing it like solo. So they don't. But in comparison, this program is a study group. So we have a group of dentists who are amazing, and we have Dr. Hannah and faculty who are constantly answering our questions from everything from treatment planning to technique, materials to use, the implant company to go for, and bone grafting. So there's just so many things. So and yeah, there's so many other things that I've heard about other programs like which like do not even like compare to what we are at. This is something so unique, and I think this is from what I've heard from everybody else, this is the most unique implant placement program, and this is the best one from what I have seen so far.
What do you think of the 1-year commitment?
So initially I was expecting 1 year. I think this is too long. Will this be too much? But then I'm so happy I made this commitment, and I feel this is like a very 1 year I would say is a great amount of time.
Guys, we gotta go.
1 year is a great.
Say that again.
Okay. So the 1 year commitment, initially I was like, okay, is this too long? But now I'm feeling it's too short. We are in August right now, and there's just 4 more months, and I'm like, no, I still have to learn so many things, and I still want to do so many things that I have observed Dr. Hannah doing and the level 2 students doing that I want to do as well. So it's perfect, but I feel that there's so much more. Like I've already placed several implants, but there's so much more.
Would you recommend this program to someone else?
Yes, absolutely. I have talked to so many of my friends about this program, and yes, I have been talking to I think everybody of my dentist friends about like coming and just observing and being a part of the program.
Oh my God.
Just read it again.
You just finished a clinical day. Can you give me a brief rundown of your day?
Yeah, so my first surgery of the day was extracting and placing bone graft, and this was the technique was so important because the patient had no bone on the buccal, and we had to make sure that we conserve the tissues, and we had to be very conservative and there were minute details to the technique, and Dr. Hannah made sure we did the best for this patient. And my second surgery was extraction and immediate placement of implant, and it was tooth number 14. We extracted the tooth, we used Versa burrs to expand the socket, and then we placed the implant, and then and the third one was placing an implant on tooth number 18. So it was an amazing day. I thoroughly enjoyed it.
Thank you. Thank you so much.